Okay, so I'm going to perform the skill of inserting an IV. In this patient's case, she had an IV in her left arm and it infiltrated, so she needs a new IV. She has an order for a saline locked IV. So what we're going to do first is prime the saline lock. You're going to need a clave, and this is the cap right here for the clave. It's sterile, so you want to make sure not to contaminate it. This is the saline lock, also sterile, so you want to make sure when you pull this off you're not contaminating it. And then you just screw this clave onto the saline lock. And then to prime the saline lock, you have your normal saline. And I still haven't touched this area, so it's still sterile. If for some reason I did touch it, I could alcohol wipe it and that would be acceptable. So you screw on the normal saline and prime the tubing. You're going to want to take this cap off. The tubing is primed. Recap it. So you're ready to go with that. I like to loosen the end of the cap so that as soon as I need it, I can just flip it off. But I'm still maintaining the end of that being sterile. The next thing I'm going to do is apply the tourniquet. And look for an adequate vein to go into. Then I'm going to apply my gloves. Which are a little bit sticky, but not a big deal. Okay, the next thing I'm going to do is open my alcohol wipe. I see a good vein right here to go into, and that looks like the one I'm going to go for. So I'm going to alcohol wipe from inner to outer, and then I'm going to open my chlorhexidine. And break the chlorhexidine and clean really well. And then you want to wait for that chlorhexidine to dry. I'm also going to have a 2x2 close by. And then I'm going to open my needle. In this case, I am using a 20 gauge needle, which is a pretty standard needle for an IV. So I'm going to hold it between my thumb and forefinger, and I'm going to have the hub up with the bevel up. With my left hand, I'm going to stabilize the vein, and I'm going to go in kind of over my thumb at a 45-degree angle. And then as soon as I see flash, which pretend like I see flash, I'm going to advance the catheter into the vein. And if you listen, you can hear the click. As soon as you hear the click, you're going to pull the tourniquet. You also want to make sure you're stabilizing this part of the needle, the catheter. The next step is I'm going to insert the saline lock into the catheter. So this is when I want to put my gauze right here, and I'm going to pull the needle off and insert the saline lock and screw it on. After I do that, I'm going to take a piece of tape and temporarily stabilize this hub so that I can assess whether or not this has been infiltrated. Now I'm going to flush the vein, and I see that it's patent. It's flushing easily. There's no problem with it. So that means that I've gotten a good sight, and now I'm going to remove my gloves and apply the Tegaderm. You want to place the Tegaderm on the catheter area, not on this part of the hub, because you may need to reinsert a different saline lock later. After the Tegaderm has been established, you want to further secure the saline lock. So you're going to take another piece of tape and secure it as such. This in the sharps.